Hello, my name is Andrea Juarez Hernandez. I am 16 years old and I am a member of the Lurie Children's Kids Advisory Board and the Kids Illinois iCAN chapter. On behalf of the iCAN 2020 Summit, we would like to recognize our first ever healthcare hero, Dr. Larry Kociolek. Dr. Kociolek is a pediatrician at Ann and Robert H. Lurie Children's Hospital of Chicago, who specializes in taking care of kids with infections. He is also a healthcare epidemiologist, which means he studies how patients and healthcare workers get sick and works with the hospital to keep children and healthcare workers safe and healthy. Dr. Kociolek and his wife Lisa have 3 children: Grayson, age 12, Landon, age 10, and Sadie, age 7. All of us at iCAN would like to thank Dr. Kociolek for putting pediatric patients first and being an amazing doctor and an inspiration to all.
The global pandemic has changed our world, and here's what I do to make sure we stay safe. My name is Dr. Larry Kociolek, and I'm a pediatrician who specializes in providing care to children with infections. I work at the Ann and Robert H. Lurie Children's Hospital of Chicago, which is in Chicago, Illinois. In addition to fighting the COVID-19 pandemic, I have many roles. First, as a pediatric infectious diseases doctor, I take care of children who are fighting infections. We work with doctors, nurses, and other healthcare workers to determine if children in the hospital have an infection, and if so, what germ they are infected with. We then develop a safe and effective treatment plan that is unique for each child. Next, I'm a scientist. My primary research focus is something called Clostridioides difficile infection, something you may know as C. diff. C. diff is a bacterium that causes a gastrointestinal illness in kids and adults. My laboratory finds better ways to diagnose C. diff in children and determine how children become immune to C. diff, with the hope of eventually being able to vaccinate children against C. diff and prevent future infections. Finally, I am a hospital epidemiologist and the medical director of infection prevention and control at Lurie Children's. What that means is that I work with a very large team of dedicated healthcare workers and scientists to study how children develop infections in hospitals and their communities. We then find ways to keep children from being exposed to and infected with viruses and bacteria. By doing these things, our main goal is to keep children, families, and healthcare workers safe and healthy. Part of this important role is studying new infections that emerge in the community. It is this experience and interest that has made me well suited to lead our hospital efforts to respond to the COVID-19 pandemic. During the pandemic, I have been one of many people at Lurie Children's who has worked tirelessly over the past several months to continually monitor the burden of COVID-19 in our hospital, community, and worldwide. So far, we have diagnosed COVID-19 in nearly 700 children. Some of the specific ways we have responded to COVID-19 and helped kids, families, and healthcare workers include the following. Our scientists have developed a test to diagnose COVID-19. We have taught children and their families about how to keep themselves safe and healthy. We have taught our healthcare workers how to safely provide high-quality care to children without they themselves catching COVID-19. We have studied new medicines and other treatments to learn how to best treat COVID-19 in children. And now we're in the process of fingerprinting the COVID-19 virus to understand more about the specific virus types that make kids sick and how those viruses are passed from person to person. The pandemic is far from over, and we will continue to do this important work. As we learn more about COVID-19, we will continually change our approach to make sure we are doing everything we can to keep children healthy. But there is no single hero in our work. There are literally hundreds of heroes at Lurie Children's and hospitals worldwide working hard to fight COVID-19 and keep children like you healthy. And we also need children like yourselves to help us in this fight. Some things you can do to keep yourselves and other children healthy is to wear masks or other face coverings when you're in public. Do your best to stay at least 6 feet away from other people when you are outside your home. That's something we call social distancing. And to stay home if you are feeling sick. In addition, we need you to continue to advocate for better healthcare and research in children. We need to know how COVID-19 impacts you and other children, what things we need to teach children about, and what we can do to make sure children receive the best healthcare possible. In addition to myself and the many heroes fighting COVID-19, you too are heroes in this fight. Thanks for listening to my story, and thank you for all of your efforts and advocacy.